Yes.
All right, welcome back to episode 49 of Mind Over Music. I'm your host, Sean Ali Moladina. Today we have three incredible guests. Today's topic is going to be on fulfillment. A lot of things that we do in our lives, it's not simply to make us happy, but rather to find our true north and to create fulfillment within our lives. There's a very special organization that I've been intimately involved with over the last, I would say, 2 to 3 years. And from the beginning, Nisha Mandani, who is the CEO and founder of OurAIM Foundation, has done some incredible work with creating equanimity across the world to villages, to refugee camps across the world, in creating schools, women's empowerment programs, shelters, bore wells, and healthcare resources. So I want to thank my panel here, but starting off with introducing everybody to the CEO and founder of OurAIM Foundation, Nisha Mandani. Nisha, thank you so much for being on the show tonight.
Thank you so much, Ali, for having us on the show.
Oh, I'm so excited about this interview, and she's joined by two incredible individuals, Dr. David Barsley, who's representing also the Rotary Club, who's going to be talking about his involvement through the Rotary Club in Tampa specifically. Dr. David Barsley, thank you so much for being on the show as well.
Privileged to be here. Thank you so much for having us.
Absolutely. And finally, Dr. Amir Narani, who's doing some incredible work, mission work, alongside OurAIM Foundation to bring healthcare to these remote villages across Africa, and as well as other places such as Rohingya, and places that OurAIM has such an important footprint. So Dr. Narani, thank you so much for being on the show as well.
Thank you for having us over.
Yes, absolutely. And so I want to get started with explaining, the collaborations around the Rotary Club. So for Dr. Barsley, what got you involved, and what got the Rotary Club involved with OurAIM in the first place? And how were you able to present OurAIM Foundation, to the Rotary Club itself, to be able to get some legs behind some of the programs that OurAIM has been essentially, running for years now?
Well, let me start at the beginning. There are 4 avenues of service for Rotary clubs, and one of them is international service. We have been doing international projects long before I met Nisha and OurAIM. I, in particular, have been doing Rotary projects since the late 1990s. So this was not the first time. I met Nisha for the first time 2 years ago, and it was really in the context of doing a Rotary project, a Rotary funded project in Bangladesh. Before that, I'd never even met her. So we'd worked with a number of organizations. She's one of them, and we're now thinking about doing a project in Malawi. So that's the connection there. But for me personally, I'm representing Rotary International, specifically my club, which is the Rotary Club of Seven Springs. We've done, since 1996, 13 projects all across the world, in every continent except Antarctica and Australia. Total projects over $1 million. So my connection is always to find somebody with boots on the ground that's doing good work in a host country, and Nisha presents that opportunity now for us in Malawi.
That's wonderful. And what was it specifically about OurAIM Foundation's efforts that drew the Rotary Club to start funding these types of projects?
Well, a couple of things, really. I've always taken it as a philosophical argument that you should never try to do these projects on your own. I can't invent something in Malawi or invent something in Guatemala. So we try always to find some agency in the host country that's already doing good work, usually a private not-for-profit company, almost always a faith organization, because they tend to be fire in the belly kind of people, very organized and very committed to doing good work. So I've partnered with people all around the world. I've partnered with Jewish groups, Muslim groups, Hindu groups, Roman Catholic missionary hospitals, and evangelical Protestant organizations. Almost all of the 12 projects that we did involved some collaboration with a faith organization, a faith-based organization. So we just found Nisha and OurAIM to be a kindred spirit in this sort of thing. She's not technically a faith organization, but she has many elements in common with a faith-based organization, and she certainly has the fire in the belly and the commitment to do good around the world. And that's what we're looking for when we're trying to partner with people.
I love it. I love it. You know, it's may not be faith-based, but it's absolutely faith-inspired. Our aim is, and
I think that's exactly right.
Yeah, no, I love it. I love it. And David, you know, I want to talk a little bit about fulfillment, right? And so when you do your work, as you look for these organizations and you start looking for, certain ways of qualifying some of these organizations as well, what creates fulfillment for you? What is that one part of your day or one part of your life that you say, you know, this is the thing that I'm going to move toward my true north, and this is what really fulfills me. So what is that part for you?
Well, that's really a complicated question. I have found my whole life has been built on service. I was ordained by the American Baptist churches. I went to theological seminary before I did my true graduate work. So I've always had real interest in being of service to others, and particularly being part of faith-based organizations. I think I had mentioned to you earlier in our correspondence that I consider Rotary to be sort of almost like secular religion. It's not a true religion, but it is a secular organization that serves an essentially religious element in people's lives, in that it gives you the same feeling of fulfillment that you're talking about. I've always found that to be true in Rotary, and it is one of the things that inspires me. My whole life has been trying to do good around the world. Most of my life, I worked for private not-for-profit organizations, mostly writing grants. And I don't write small grants, I write large grants. And when the grants get funded, they're the kinds of things that change people's lives and transform people's lives. Many of the things that I wrote grants on behalf of are still operating around the world. I wrote my first grant in 1972, so that gives you some idea how long I've been doing this. And some of the things that I did in 72 and since are still operating. And that just gives you, at the end, as you come to the twilight of your life and you look back and say, what difference did my life make? That's a good way of looking at things. There's many of those things that I accomplished and caused to come into existence are still functioning even today.
Yeah, and the last question I want to ask you here is, you know, going along that same train, that same theme, right, of looking back at your life and, you know, figuring out what worked, what didn't work. You know, what are some of the lessons that you learned in doing this work? If you could give us a couple of takeaways, you know, as we look to, you know, create, you know, funding, as we look to support our specific nonprofit organizations, you know, what are the things that we should look for, you know, when doing the good work and fighting the good fight?
Well, again, that's a good, complicated question. We probably could speak hours on that issue. I've always, as I said, worked for private not-for-profit organizations. I've made it a tenet in my life to never say, my organization needs this or my organization needs that. I always say, my organization does good things in the community or in the world. We could do more if we had more money. You want to help us, give us some money, but we don't have any needs. It's our clients that have needs, and that's what we're trying to fulfill. So I've spent my life just trying to do that. Put the focus on people that have needs. How do we hook up those needs with people already in the locale that are providing services that meet those needs? That's true of writing grants, it's true of Rotary, it's true of OurAIM. It just runs the gamut through all these kinds of endeavors.
Yeah, Dr. David Barsley, I can't thank you enough for not only your support, but the work that you're doing around the world and representing the Rotary Club in such a positive light. Your work is absolutely essential as well as it is critical. And I can't thank you enough for being on the show today.
It's my pleasure. Thank you so much for having us.
Oh, I love it. So now I want to move to Dr. Amir Narani. And Dr. Narani is a physician who has worked specifically with OurAIM Foundation, but has been doing so much missionary work across the world, you know, starting with his time. I believe you also went not only to the trip in Malawi and so helping to set up the medical camps there, the pharmacy that you worked along with, the latest missionary work that was happening there, but also having ties to the camp in Rohingya as well. So, Dr. Narani, thank you so much for being on the show tonight.
Thank you.
So, Dr. Narani, let's talk a little bit about some of the missionary work that you've done. What it is to be a physician and to bring health to these, almost healthcare deserts around the world, where they don't have access to proper healthcare, where they don't have access to proper agency within their own healthcare. How do you go about moving into this type of mission work?
Well, being a physician, my eyesight is on the healthcare wherever I want to go and help. So that will be the first aim. So that becomes the center that I work around it. I may do other work also, not particularly medicine, but other missionary and charity and work. But the medical work gives me the most satisfaction because that's what I'm good at it. That's what I like to do. And that's what I know brings more happiness and joy and satisfaction on the part of the patient who receives it and their families, and they can get back to function in good health. And that's a very good, rewarding feeling for us.
Yeah, because it's not, I think when an individual receives proper health care, it's not just that individual that's becoming
Exactly.
standing up, it's the entire community, because it trickles down to their family, and that family is impacted by the community as well. So it's some incredible
That's
work
correct.
that you're doing. Tell us a little bit about, if you can, give us a story that inspired you, that helps you continue the work. Because, Nisha and I were talking as we were preparing for this show, and, she said, Dr. Narani works tirelessly. He does not sleep when he goes on these mission trips. And he's so hyper-focused. What leads to that hyper-focus? And if you can, share a story with us that keeps you motivated to do this work.
Well, I always like to help people around our community wherever there is an opportunity arises. But about 4 years ago, Nisha might have told you that we were in a very bad accident and we were just lucky to be alive. And that was more like an eye-opener for us that maybe before our life ends on this earth, we should do something. So that's what the biggest motivation was. And then of course, the Rohingya situation came to the surface, and we took the opportunity and we put the group together under OurAIM Foundation and some other doctors together, and we went there and just did whatever we could, yeah. And then we are trying to continuing, and then we felt that maybe we should go to some place with Malawi was one of them, that we can just stay with one village and just bring them up holistically, not just medical. Medical care is very important for them. So that's where we get more and more involvement with that, and we want to continue to do this work. My wife is also very helpful in this, and we are kind of pushing it forward as much as we can.
Yeah, when you approach a new community and you see that there's so many parts, right? Especially everything from physical health to mental health to not having access to resources such as water, shelter. When you walk into these very desolate and almost sometimes hopeless situations, where do you begin? What is the first thing that you focus on when you are bringing healthcare back into a village or a community?
Well, we are by our nature of education, we are aware of what kind of disease is more prevalent, what kills them, what brings them the more illness, what gets in the way of their enjoyment of life and going forward. So those are the things we project. For example, malaria is very common in the part of Africa. So we focus on treating the malaria, preventing the malaria, and so for educating them. And then we go from there. And from then on, other things keep on emerging. So last time we went there, we had some specialty clinics there with OBGYN and dental clinic and so forth, and eye doctors. And we found a lot of people who needed something as simple as just a pair of eyeglasses that can cost about $2, and they can see. So a lot of things kind of mushroom out of that, and we continue to forward it.
Yeah, no, this is incredible work. And Nisha, I want to bring you in a little bit, because this is the first thing that you and I talked about was it's a lot of listening. It's a lot of asking the right questions and knowing who to serve and where to serve, right? Talk to us about how OurAIM Foundation found the villages in Malawi and how the network expanded from one simple question that you asked, which was, who needs help, right? So talk to us about that trip that you and Raju Uncle took in Malawi, and how the work extended from there.
So first of all, thank you so much, Dr. Dave and Dr. Amir, for your insight and for your support. Nothing would have been possible without having a volunteers, without having a donors, without having a supporters and the well-wishers. OurAIM Foundation started with a passion, with a seed in our hands 12 years ago, and we soaked it, and a lot of people nurtured it with love, passion, commitment, and their service. And today we are just seeing the fruits of it. And I honestly feel every person who has nurtured this seed is the real person who should get the credit for OurAIM Foundation, and which are all the volunteers, which are all the staff in Malawi, all the donors. And I really want to thank all the volunteers, especially the doctors who came from America to set up the clinic in Malawi. And first person, me and Dr. Narani's wife, Farida, when we thought of going to Malawi, we said we don't want to just do like a medical mission of going, seeing patients and coming back. We said we want to do something permanent that will continue, because you cannot just feed someone steak one day and keep them hungry for the rest of the month. So we said, let's start something more concrete. And I can't thank enough to Mrs. Narani, who was instrumental in taking us and connecting us with different doctors in the community. So she put together a whole team of doctors, and we all went together, and Dr. Narani, Dr. Haya, Dr. Farhana, Dr. Bushra, there were many doctors that joined us, and Dr. Dipti Mehta. So all these doctors were led together as a team, and they put this clinic together. But while the doctors were doing their jobs, all the wives and other volunteers who joined us, we were focusing on sewing for the women empowerment. We were focusing on the children's education. We were focusing on how to start the lab, computer labs for the youths. So it's just a joint efforts. I would say that it's a big puzzle. We have seen a puzzle of 1,000 pieces. This is a puzzle of 1,000,000 pieces. Just came together very perfectly, fit together very perfectly, because everyone who joined OurAIM Foundation, they joined with passion. They joined with love. They did this just for the satisfaction. Nobody was looking for any credit. No one was doing this to just get on the show or get any rewards for it. Everyone did it for their own self-happiness, self-contentment. And I think the program of tour today is like fulfillment. And I would assure you, every person, every donor, every volunteer has felt that, has been inspired to come and join because of that fulfillment. And I truly want to salute each one of them and thank them.
That's wonderful. You know, I think when you land somewhere, right, and going back to that story of how Malawi was even founded as a place where we needed to bring resources, where we needed to help empower the community. This came at the heels of Rohingya. So there was a huge humanitarian crisis in Myanmar, and there was a huge group of people that were displaced at the border of Bangladesh in the Rohingya refugee camp, which is the largest refugee camp in the world today. And such amazing work was done there to create shelters, borewells, women's empowerment programs, and schools and things of that sort. So we did have that footprint. And the one thing that I found that was most interesting was it was the community that was doing 90% of the work. We were simply organizing and bringing materials to the campsite. And from there, the community was coming together and saying, okay, this is ours now. And they would create the self-sustainability within it. So the program worked out extremely well because the footprint was, how do we empower the community, hand over the materials, hand over the resources, and have them become accountable for the projects that we want to help them implement. That would help their community the most. So how did this story begin in Malawi?
So anywhere you go, if you don't do the partnership with the locals, with the villagers, they need to take a pride. They need to take a credit of it. So anywhere we go, like in Rohingya, how we did, we hired the Rohingyans. We gave them the materials and they became the owners of their homes. They became the owners of the bore wells. They are running the schools over there. The Women Empowerment Center, they're running it. So anything, if they do it, then they take a pride in it. And pride is the most important thing, because that one thing, most of these people in the villages or in the refugee camps, they're lacking that. Because either they're abused, or either they're raped, or either they've been hungry for days, or they have buried their children, or some of the children might have buried their parents, or these people have seen, which we can't even imagine, so horrible things they have gone through in their lives. So I think, if you give them their honor back, their pride back, they will do it with their 110% commitment. And the pride I take is, when we started in Malawi, it was an eye-opener. Just a bore well. Just when we started a bore well, and that was also the first bore well donated by Dr. and Mr. and Mrs. Narani. When we started then in Malawi, the tears of joy of the whole village coming together to celebrate. And they were praying to God that we never expected this to happen in our village. It's a bigger blessing than we ever dreamt of. That sentence gave me goosebumps. Just a water has made them so proud and happy. So I think, because they dig the bore well, they dig the well over there, and we put the equipment over there. So we always work in partnership, and that gives them the pride and honor that they all deserve.
Yeah, absolutely. And I want to quickly ask Dr. Narani a question. In the same light, right? In the same avenue of understanding, healthcare and community health. What is the change that you see at a local level when you empower people to create agency for their own healthcare?
Yeah, like Nisha said very nicely, that people feel that somebody is listening to them, somebody is paying attention to them. It raises their self-esteem, and they start taking care of themselves. They learn from the experience at the various clinics and encounter with the doctors and pharmacists, and they start implementing these things in their daily life, and they start self-improving their healthcare and start paying attention to their healthcare needs and seek help, And so I think that is another part of the being there, is you giving them the education that they absorb just by being around and start taking care of themselves. So that is a very big set. So we are not there for too long. We're there for a week, 10 days or so, but we leave a good impression on them, I think, and people look forward to see us again.
Yeah, I think this
training, excellent trainings. Yeah, they put excellent trainings in place, So
Yes.
actually, I want to just add something here. The Department of Health of Malawi has ranked our clinic as a #1 best clinic in the Malawi. And that credit goes to all these doctors who just go for maybe 10 days, but they put the process and training in place,
That's right.
which is just carried on later on.
That's wonderful. I think when you walk into a community and you empower them with education and you give them just enough to create this platform where they can be accountable for their own health, that's what you call agency. I think agency is probably the most important part of self-dignity and the work that underlies everything that we are doing. Dr. Barsley, I want to also ask you, when what is the most effective thing that you see in terms of when we fund specific programs? What are some specific things that you see will always work whenever you say, hey, I'm going to write this grant to support this type of project, and I'm confident it's going to work because of these things? What are the specific criteria that you feel confident in investing in from a grantor's standpoint?
Okay. From the point of view of Rotary grants, we look at a couple different things. First of all, we have to find a host country. You need to find a host country, usually a third world country that has a problem. That's not hard. Third world countries are nothing but breeding places for problems. Then you need to find a Rotary club over in the host country that's willing to partner with you. Not that they would give a lot of money, but that they would handle a lot of the logistics. And then the third thing is, you need to find an organization that's already there with boots on the ground. That's what OurAIM is doing for Rotary and for me. who already have boots on the ground in Malawi. They already had boots on the ground in Bangladesh. And so, I mean, I can't make it my life's work to dig bore wells in Malawi, but I can find money to support people that are digging wells in Malawi. So that's what we're doing.
Yeah,
Whenever
absolutely.
we go to one of these countries, first thing I want to do is ask the people, what is it that you need? I can't go there and tell people what they need. I cannot tell you how many times I've gone to a third world country, met with them, met with Rotarians, and said, if I could get you $50,000, what would you do with it? And it's amazing. First of all, it's amazing how creative they are. And second of all, it's amazing how far $50,000 or $100,000 can go in a third world country compared to how far it would go in our country.
Right. Yeah, and it's almost where these grants end up creating a government-like support system, and because you have a huge need for so many resources, it also aligns really well with innovation. And the people who are really motivated to get these resources, you're absolutely right. These projects become products of the community, and it's so easy to spread that. With the endorsement of the Rotary Club, with the endorsement of our medical staff. Nisha, I want to come back to you, and as we wrap up this interview, I want you to, if you can, give the information to all of our listeners, to all of our viewers, of where they can go to learn more about our AIM Foundation and where they can go to donate to specific projects.
Absolutely. Actually, I just want to share something that in the month of October, we are planning to go take another trip to Malawi, and Rotary Club is planning to join us for their discovery. And many other doctors are planning to join us as we plan to expand our programs in Malawi in those remote villages that we have adopted, 126 villages where 35,000 people are living. So if anybody would like to join, any medical professionals or any volunteers, they all are more than welcome to join us. And more information can be found on the website, which is OurAIM.org. OurAIM.org. And I want to just bring that 100% of the donation goes to the cause. We never had any payroll on our OurAIM Foundation in last 12 years. We are on platinum status on Charity Navigator for last 12 years. And we have volunteer-based and very strong volunteer base in all the countries that we work. So the local boots on the grounds are extremely strong. We do not start any project in any country unless we build that strong boots on the ground. So I just want to thank all the donors, once again, all the well-wishers, and I want to request if anyone wants to learn more about the foundation or join us on our humanitarian next trip to Malawi in October, please visit the website, and we would love to have you and learn more from you.
And how do they connect with you directly? If there are specific donors or if there are specific communities that want to help raise awareness, how do they get in touch with you?
So on the website, we have you have my phone number, you have my email address and my mailing address, and you can reach me at Nisha, NISHA, @OurAIM.org.
That's awesome. Good. Nisha at OurAIM.org. I want to thank our panel, Dr. David Barzilay, Dr. Amir Narani. Thank you all so much for doing the work that you do, for bringing so much love, kindness, awareness, and empowerment to the communities around the world that need it the most.
Thank you. Thank you for having us over.
Absolutely. Thank you, Dr. Barzilay. Awesome. So that is it for the interview, and we bid you all farewell.